Hi.
Hi, my name is Bernice Clark, and I'm here to inform you about the complications of diverticular disease. Diverticular disease consists of two major formations, diverticulitis and diverticulosis. Diverticulosis is the formation of numerous tiny pockets in the lining of the colon. Diverticular ranges from a pea size to much more larger sizes. They are formed by rising pressure and some weak spots in your intestinal walls by gas, waste, or liquid. Diverticular is developed during a bowel movement when straining, accompanied with constipation. They are more dominant in the colon, or better known as large intestines. About 20% of people with diverticulosis can lead to various complications. One of these complications, more seen, is rectal bleeding, or known as diverticulitis bleeding, and the other, diverticulitis. Diverticulitis is quite common and happens to 10% of people over 40 and 50. 50% of people over age 60. The predominance of diverticulitis increases with age and infects almost everyone over age 80. People with diverticulitis often have no symptoms, but they may have bleeding and cramping in the lower part of the belly. Rarely, they may notice blood in their stool or on toilet paper. Symptoms of diverticulitis are more severe and often start suddenly, but they may become worse over a few days. They include tenderness, usually in the left lower side of the abdomen, bloating or gas, chills, nausea, and vomiting, not feeling hungry or not even wanting to eat. Doctors are not sure what causes diverticular disease. Many think a diet low in fiber is the main cause. Fiber is a part of food that your body cannot digest. It is found in many fruits and vegetables. Dr. Robert Van Vieren of UCLA's medical school found many of his patients, when given a high fiber diet, becomes less affected by the disease. I have the disease and will explain to you what I have experienced and the effects I have done to prevent complications from it. Diverticulitis symptoms can cause a lot of problems for people. And in these times, you'll see how many people are starting to be affected by it, especially those who live in industrialized countries. If you're not familiar with the condition, it's caused by diverticulitis, inflammation in the colon or large intestines. Diverticular are small sacs or pouches formed on the colon due to improper diet and various risk factors like age and others. Although people with this condition will not present any symptoms, inflammation and bursting will start showing diverticulitis symptoms. However, many people don't really take care of these symptoms since they relate it to other problems and just leave it alone. Here are some symptoms I really didn't take seriously, since they can be mistaken to other problems, and later I found were much more serious than I imagined. I will give a thorough explanation of each symptom. Fever. Most of the time, fever is usually linked to the pulmonary conditions like colds or flu. However, fever is also a sign of possible infection or inflammation inside the body. Abdomen pain is one of the common diverticulitis symptoms mistaken with other conditions. For localized abdomen pain and tenderness, people would think that it's just regular cramps. However, if this pain is felt in other sides of the belly apart from the lower right side, then you can say it is diverticulitis. This is also among diverticulitis symptoms linked to other conditions felt in different areas. One of the things to take note on this condition, however, is the possible cause of constipation. For example, constipation can occur after eating something, will indicate that it's possibly caused by food you ingested. Again, these symptoms may be related to GERD. Most of the time, vomiting and nausea caused by GERD are usually followed by heartburn, or without this, additional symptoms may point to diverticulitis as its cause. Today you've learned about the disease diverticulitis and its complication and how they affect many across the world. These are some ways that the disease can be treated. Bed rest and possibly use a heating pad on your belly. Take medications prescribed by your doctor. Drink only fluids for a day or two. Then slowly begin drinking and eating food. Avoid beans, peas, tomatoes, strawberries, pickles, and cucumbers. Ask your doctor about eating nuts or seeds. Do not drink too much coffee, tea, or alcohol. They can make constipation worse. In closing, I would like to inform you, the audience, if you frequently have stomach aches, fevers, or any other symptoms mentioned, don't look over them. These simple feelings can be much more serious than you think, and something as simple as changing your diet could affect it. If you're not feeling yourself on a regular basis, get a doctor and take a look at your health.